Can you hear us okay? We are, going to be recording today's session. So I just wanted to share the link in the chat box. You can find it there. We also have the captions link listed. And I'm going to share our PowerPoint as well, so you can see that. And if you have any questions as we go along, you can go ahead and feel free to add those in the Q&A box, please. And then we may be able to address some of them as we go along, if we can see them at the same time. But definitely go ahead and feel free to type them in there. So I'm going to get this set up. Today is the Hearing Aid Coverage for Children program webinar for medical providers and hearing professionals. So I hope you're in the right place. If not, welcome and enjoy the fun with us. We will be going through just some program overview and updates. We're really glad to have you here with us. And I wanted to introduce my co-presenter today as well, Dr. Stephen Kamuka from our TAR review team. Dr. Kamuka, do you want to say anything?
Hello, everyone. Good afternoon and happy holidays.
So we'll just kind of go through some general housekeeping. We've got the link for the presentation today, like I mentioned in the chat. We also have live captions available today. That link is also in the chat and on your screen. This is a relatively recently launched program in the scope of state programs. We've only been around for about 2.5 years now, since summer 2021. A lot of what you'll see today is pretty consistent with fee-for-service Medi-Cal. So if you're already used to that system and serving children within that system, that is pretty much the same process that we'll use for almost everything. So we'll go through and talk about a little bit the purpose of HACCP and hearing aid coverage for children was actually to kind of bridge a gap for children who do not already have or are not eligible for Medi-Cal or California Children's Services hearing aid coverage, and either don't have private insurance or have private insurance that excluded hearing aids. We've since expanded to also cover supplemental coverage for hearing aids if someone has a plan that only covers up to $1,500 per year towards hearing aids. This is specifically for children under 21 years of age who live in California. And like I mentioned, if you're not already eligible for Medi-Cal or CCS, and we've got an income chart here on the next slide for this, all the way up to 600% of the federal poverty level. Federal poverty level, or FPL, is updated every year by the feds. It's we've got the California specific numbers here. So for 2023, if you're in a family of 4, you would be eligible for HACCP as far as the income criteria goes. If your household income is greater than $79,800 a year, all the way up to $180,000 a year for adjusted gross income. If your patient has any questions about whether they fall within that range or which income applies or anything like that, we do also have a call center that I'll provide all the information for at the end of the presentation today. Please call us, or invite them to call us. We're happy to help. We want to make this an easy, straightforward process for you. Again, if your patient is already enrolled in CCS for a hearing-related condition, we don't offer anything that CCS doesn't already offer, right? So we're standing on their shoulders in a lot of ways. So you would want your patient to get all of that fully expansive coverage. Additionally, if you're referring a patient over to us, we would appreciate if you could help them make sure that they have either a hearing aid prescription or a referral, which we have a form, or you can use a free form letter is fine too, whichever is easier, just that, they aren't requiring either hearing aids or further evaluation for possible hearing aids. That's a bit more generous than some of the other diagnostic standards, but we do need to have some sort of medical eligibility process. So that's the easy piece there, but we just have to have it attached. And then again, if they either don't have other health coverage for hearing aids, such as through a private plan, or they do have that insurance, but it limits their annual benefit for hearing aids to $1,500 or less. And they can show us that a couple different ways. These are really easy to just attach now that we've got the online application portal for enrolling in HACCP. If they've got a denial of coverage notice for their child's hearing aids from that plan, or if they have an explanation of coverage that says, you know, they don't have hearing aids covered in the plan, or that hearing aid coverage is limited to X number of dollars, or if they simply sign on the application that they don't have health insurance. That's the short version for that one. Application is easiest online. We highly recommend using the online application portal. It cuts down on time that just gets soaked up by mail. They can also download an application form from the HACCP webpage and type in, the fillable PDF and then print, or they can print it and fill it in by paper if they prefer to fill in by hand. And then they can either mail or fax that to us or upload it through our secure web chat option. Again, all of the applications, whether you're attaching and submitting online or whether you're sending in a paper copy, do need to include the documentation for household income, for any existing health coverage, and then that hearing aid prescription or provider referral. We determine eligibility within 10 days from receipt of complete application. If we get an incomplete application from you, you'll hear from us anyway, and you'll get to have a fun conversation with us about, or your patient, about how we can help make sure that it's accessible and attainable to get the documentation, or if we can support you in finding that. HACCP does also confirm enrollment status by mail. So we'll just send out the program ID cards, similar to how your other patients may bring in a benefit identification card, a BIC for Medi-Cal. So you're used to seeing that. HACCP just has the HACCP imagery and wording on it, and is specific to the hearing aid related benefits. HACCP relies on the same providers that already are enrolled in Medi-Cal. So if you are new to the program, but you're already enrolled in Medi-Cal, great. It's all the same systems as fee-for-service Medi-Cal, so that should be kind of an easy expansion. If you are new to Medi-Cal as well, we've got information here for you, and the slides will be posted alongside the recording as well. But there's all the links here to be able to enroll as a Medi-Cal provider, and that same fee-for-service system, again, supports Medi-Cal, but it also supports HACCP and actually California Children's Services as well. Sorry, I should go back one more. The other thing that I just wanted to highlight, while participation in the HACCP provider locator is completely optional, we would really, really appreciate it if you could opt into it. It makes it a lot easier for families to be able to find the relevant provider for their child. If they're looking for someone who serves very young children, or who is close to them, or accepting new patients, somebody who speaks a certain language. These are all filters that we have within the HACCP provider locator that you can list in your detailed provider listing. You can provide, preferred contact information for them to make an appointment, all sorts of things, instead of them just going out into the wide open internet and hoping to cross paths with you. So we like to make that as easy as possible for families, but we're also hoping to provide value for you as a provider so that folks are calling you about the right services that you actually provide, not about something that you don't. And then, if there are additional details that you want to provide to families who are looking for a provider, you can do that through the provider locator as well. HACCP covers everything start to finish that Medi-Cal does related to hearing aids for children. So anywhere from the hearing aid evaluation upfront, if your patient hasn't already had that, through to the otolaryngologist appointments or ENT, the hearing aids themselves, services, repairs, medically necessary supplies like batteries or ear molds and accessories for the hearing aids. And then, continuing through the post-evaluation testing and other audiology services, until they're ready for their next otolaryngologist visit, instead of hearing aids. Coverage, as long as it's a covered benefit, and these are all listed within the HACCP provider manual, which we actually have linked on the next page. Coverage determinations are based on medical necessity. So there's not a dollar cap on the, total value of HACCP covered benefits that are available to a child in a particular plan year or calendar year. So just want to make that clear. There's not a maximum, but it is based on medical necessity. So specific examples of additional covered benefits beyond just those key highlights are the hearing aid assessment, like we talked about, electroacoustic analysis, real ear measurements, minor hearing aid repairs. If there's a replacement or the hearing aids are lost or stolen, that sort of thing, those are covered the same policies as apply to children enrolled in Medi-Cal. So the treatment authorization for those is a little bit different, but I will let Dr. Kamuka talk more about that in just a minute. And then we've got the link for the provider manual as well. So I'm going to hand it over to Dr. Kamuka, who's our expert on the treatment authorization request process and all things clinical. And you just let me know when you need your slides changed.
Good afternoon, everyone. I'd like to talk just briefly about the TAR process. For those of you that are participating in Medi-Cal, you should be familiar with that. But for those of you that are new to HACCP, this may be the biggest hurdle in learning how to submit a TAR that contains all the information that's required for us to approve the TAR as quickly as possible. You've heard Kaylee talk about documentation, and the documentation is what is normally required from most plans for most hearing aid evaluations. A physical exam, audiometric testing that's appropriate for the beneficiary's age, and any other insurance information are the supporting documents, and they can be submitted as what we call a free-form attachment. They just upload it electronically to the TAR. The TAR must have from and through dates, which is just an explanation of the window of time during which the services are going to be provided. So if you're expecting to see that individual for 2 or 3 times, not only for the original eval, the fitting, and then hearing aid checks after fitting, those can all be submitted on one TAR for your convenience. As you know, each service has a separate code, and the dates of service can be added so that you don't need to submit separate TARs for each type of service. And there's no problem in requesting anticipated services and then not using those services in the future, or if the time window should change because of illness or travel or complications or other kinds of things, the TAR can be modified, extended, shortened. So it's very important to review the provider manual, the Medi-Cal provider manual, so that you understand how to do that. The more complete the initial TAR that's submitted, the quicker the turnaround time and the approval can be. I don't think there's anything else that I can share with you at this time with respect to TARs. We do have a whole team that have been specifically trained to deal with audiometric test results, to deal with hearing aids, electroacoustic evaluations, fitting services, and other ancillary devices that may go along with the hearing aid. And so if there's any question, that, as mentioned, the team has already been trained, and we have 3 physicians who have also been trained as backup to assist with the team to answer questions more quickly. Okay. Thank you, Kylie.
Thank you, Dr. Kamuka.
Yeah, if anybody has any specific questions about anything I said, please put it in the chat room and I can answer them independently so we can go on.
Okay, so we'll just keep going through the slides that we've got then. So a TAR, like we mentioned, can be submitted either before or after the service is completed or the hearing aids are dispensed. For very technical devices or high value, it's quite common to submit the TAR prior to dispensing the item in case there's helpful feedback in the TAR process. Dr. Kamuka's team is really great at letting folks know when there might be an even more ideal technology that's available as a covered benefit now that may not be in all of the publications yet or may have just come out in the publications. There are additional details, as was mentioned in the HACCP provider manual and some of the related Medi-Cal provider manuals about the specific documentation that needs to be provided alongside certain types of TARs. The most common one that applies to the hearing aid coverage for children program, I'm going to go out of order for a second here. Oops, I went too far. Is for the new hearing aids. So we'll cover those in a minute, but the kind of key pieces that you want to make sure you include are documentation of the otolaryngologist or ENT exam, including the history and the physical examination of the patient, so that full head and neck exam, alongside the hearing aid prescription or medical clearance. I think, and Dr. Kamuka, please correct me if this has changed. I realized my video's off. But I believe probably the most common feedback that I've gotten through your office is that kind of disconnect between, oh, the medical clearance came from an otolaryngologist, so that counts as the otolaryngologist exam, but you need to actually see the full history and exam notes, right? Not just the medical clearance at the end.
Yeah, that's preferable, so that we can see the whole chronological history of the evaluation process. We understand that certain facilities do this in a very different way, where there's one type of provider that does one step in the process and another provider that may give just a simple one sentence cleared for hearing aids. Sometimes that happens before the child has even had audiometric testing. Obviously, that referral is discounted if audiometric testing has not been completed. So we like to see things in sort of logical, chronological order. So the more documentation that's available, the better. We understand too that not all parents really understand the process or even the type of provider that they might have seen. And so getting the documents together sometimes is a little bit of a kind of hurdle. And when it becomes a really problematic, we can waive some of those requirements if absolutely needed, but we would prefer to have everything to justify the reimbursement.
Yeah, we've got some regulations that we're tied pretty tightly to, but our team does absolutely everything we can to help get the documentation. I've certainly connected with patients' previous providers to try to chase down some of that paperwork, and I know a lot of the others on the team have as well. So we really are here to support however we can. If you're having trouble getting something that's required for a TAR, please let us know so that we can assist however we can. The other two pieces that are required for TARs on new hearing aids would be that audiological exam or audiometric evaluation and the description of the ear to be fitted, whether it's monaural or binaural. I know you had provided some kind of clarification for us before on this slide, Dr. Kamuka, around what does and doesn't work as far as describing medical necessity. If you don't mind kind of refreshing folks on certain things are a little bit too conclusory. We need the full description of why we believe something will work, particularly if testing is not available for the more objective measures.
Sure, I think for those in attendance today, you know how difficult it is for some younger children to get accurate test results. And so therefore we can be very flexible in reviewing the information that's submitted based on the child's age. We also don't want to create unnecessary hurdles in the process so that If something just simply is not available, not accessible, if the child has seen multiple providers, if they moved from out of state and some of the records are not available, we can always be a little bit flexible. Um, I think that the most important issue, though, is that the individual who's providing documentation of medical necessity of the hearing aid has had the option to look at all of the audiometric test results, determine what kind of hearing loss the individual might have, and to opine on what type of hearing aid might be best for the beneficiary based on test results, age, anatomy, and those kinds of aspects. Obviously, a child with microtia is really different than a child who's born with sensory hearing loss. So the recommendations really need to be consistent. What we do understand is that in the otolaryngology community in California, there are some otolaryngologists who really spend all of their time providing non-otologic services, and they really don't have the experience or skill necessarily to get into the details that might be helpful to an audiologist in determining what's best needed for the beneficiary. So again, we try to provide as much flexibility as we can to sort of expedite the process and lower the burden of documentation and lower the time and amount of work that's involved on your side to get the child aided as quickly as possible so they can begin getting the benefits of hearing rehab. So thanks.
Thank you very much. And then just to clarify, one of the questions that we definitely got very often at the beginning of the program and continue to see with some level of frequency is whether we've got specific hearing loss thresholds that children need to meet, such as for the CCS diagnostic criteria. There's none of that for HACCP, not at the enrollment stage, but also not at the hearing aid TAR stage. So that's where if the tests are available, there's not a specific threshold, but we need to see, what the situation is. But if testing is just not accessible, like was mentioned, you can certainly let us know using some of the examples here why the hearing aids are medically necessary based on the information that you do have, and then work with us and work with you as well to keep the process patient focused and really make sure that your patient gets what they need in a timely manner. So we talked about, test results, definitely please include them with the other documentation if you have them. Relying on non-testing measures, kind of let us know where you're at and what you're seeing, your medical opinion, as Dr. Kamuka mentioned. We've got a few different pieces. We see quite frequently the child appears to benefit. We need a little bit more information about why the child benefits, and kind of what exactly you're observing that is perceived as a benefit. We usually cannot approve TARs on a trial and error basis, but if you've got a specific reason why you believe this is going to benefit this child, we can usually work with you. We just need to be able to follow the thought process to show, oh, okay, this isn't a guess. This is, a fully, we've tried all of these things that usually come first. And, this is why we believe this is going to be the best fit for this child. We highly recommend, as with the online application portal for coverage enrollment, we similarly really highly recommend using the electronic TAR process or e-TAR process through the Medi-Cal provider website. I believe there's been a little bit of a facelift on this page, so you might see slightly different colors if you log into it now. But the high point that I want to mention is when you're going through and submitting an e-TAR, you want to make sure that this special handling code right here, this drop-down box, you click the Hearing Aid Coverage for Children program option, and that will help make sure that your e-TAR gets routed to the team of specialists that Dr. Kamuka mentioned who are really familiar with pediatric audiology and hearing aids to make sure that your TAR gets handled as quickly as possible, but also that it goes to the right team. Okay. If you are turning in a paper TAR, You can similarly write HACCP and the special instructions section, and we can help you that way. However, with an ETAR, you get to just click and upload the attachments. Is a lot less paperwork to handle in mail. We've got all of the information here, and this, like I said, the slides will be available on the webpage afterwards for where to send those paper TARs. Additionally, if you need any help with a TAR or even checking the status on a claim, you can go ahead and reach out to the telephone service center, same as you would for Medi-Cal. They can help you check that status or answer your questions. Here's the TAR supporting documentation that we had talked about before for the new hearing aids as an example. As with the enrollment application that comes in for the family, when we get a TAR request from you, we need to make sure that it has all of the required supporting documentation to the best that it's available. And then we can kind of work with you on supporting you and accessing the rest of it if that's an issue. All of the details on documentation requirements for different types of TARs, whether it's a new hearing aid or replacement, different situations, those are all in the Hearing Aid Coverage for Children program section of the Medi-Cal Provider Manual, and that's linked right here. It's also on the HACCP webpage, which we've got later on as well under the resources for medical providers. Just wanted to cover a few FAQs that we get frequently. One is whether enrollment in HACCP and your patient having an HACCP ID card implies that they already have authorization for all of the covered hearing aids and services with the program. That's not the case. Enrollment and ID card reflect that they've been accepted into the program. They were granted coverage at some point. However, TAR approval is still required for several services. So for hearing aids, you're always going to need an approved TAR. For certain other things, like we're in an earlier slide, you likely don't require a TAR ever, or you might require a TAR only if you exceed a certain threshold. So if you use more than 2 ear molds on the same date of service or more than 4 within a year, then you would cross over the threshold into, okay, now I need a TAR for additional ones. Similarly, just like with Medi-Cal, you're always going to want to check in AVES to make sure that as of the date of service, your patient still has effective coverage. HACCP coverage is good for 1 year unless they withdraw or disenroll due to a change in eligibility prior to that. Towards the end of the 12 months, we give them a heads up, like, hey, if you need your coverage to continue past this 1 month or 1 year period, we need this updated form from you to make sure that you're still eligible, haven't moved out of state, things like that. So just know that same with Medi-Cal, you know, the ID card reflects that they've been enrolled, but that can also lapse. So please make sure to check in AVES. We want to make sure that you get reimbursed for all of the services you provide. Authorization is tied to a particular provider who submitted the TAR. So if your patient lived in Los Angeles and had an HACCP provider in Los Angeles, but now they're moving up to, you know, San Francisco, and they're going to be seeing you in San Francisco, makes sense that they would want to change providers. But if their Los Angeles provider already submitted the TAR, that's not going to work for you to submit the claim if you then dispense the hearing aids based on that earlier TAR. You need to actually submit a TAR and can have all the same information. That's fine, but it needs to be tied to your provider ID. So what we'll do in the system, or what Dr. Kamuga's team will do in the system when they see that, is they'll just make sure that we don't still also keep that prior provider's TAR and then essentially double dispense to the same patient. So we'll clean that up on our end. We just need that updated TAR from you with your information attached to it as well as the patient's, and we can kind of help sort that on our side. But you will want to have a TAR tied to your provider ID before you submit a claim so that there's a TAR to match your claim up with and make sure you can get paid. Time frame for TAR review is within 30 days of receipt. Generally speaking, and the special handling code really helps with this, we're able to beat that a lot of the time as long as we get all the information right away. In order to confirm benefits are active or that hearing aids have not already been provided by another vendor, which would make it so we don't anticipate the patient needing hearing aids again quite so quickly unless something happened out of the ordinary. You would want to, again, check AVES to confirm that their HACCP enrollment is still active. And you can use the TAR process to ensure that we haven't already just dispensed or approved hearing aids from another provider. Again, if it's just something as easy as a provider switch, you can let us know that as well, and it'll save getting a call from us like, hey, we already have one for this family. Just to double check and make sure that we're not duplicating. Authorizations are not issued as a group like CCS does, where there's a predefined service code group like SCG04. But what we can do here is, especially within the ETAR system, use multiple line items to essentially customize your own service code group and still submit that all at one time for up to a year. So if when you're submitting a TAR for your patient's hearing aids, you already anticipate because of their age or development that they're going to need more than 4 ear molds or additional follow-up services that may require TAR approval, things like that, you can submit all of those together. And that way we've got all of the reference materials that you've already sent for the hearing aids to go ahead and streamline approval of the related benefits as well. And we'll just get that out of the way for you. I think Dr. Kamuka explained earlier, but just to throw it out there again, our claim system, then when you submit the claims for having dispensed those different pieces, even if it's over time or for providing those additional services, it essentially uses your approved TAR as inventory to count against. So say, oh yes, we approved 3 of these. This was only the second one. Go ahead and pay out the claim. So we'll try to make that just as easy and streamlined as possible for you as possible by recommending that kind of multi-line ETAR that we take advantage of that. If you've got any questions about that, please also let us know. We're happy to set up and walk through with you, your first TAR or couple TARs with the program. Make sure that you know which buttons to click if you run into a question or anything like that. We're right here with you, so definitely want to make sure that this is as easy and intuitive as possible. HACCP does reimburse providers for covered benefits according to the fee-for-service Medi-Cal rates. So those are all available on the Medi-Cal rates page, which we have linked here. We recently had legislative authority go through. We're very excited to restore full reimbursement rates for audiologists. And then we did have also the claims submission and billing example form, if you haven't seen this before. But just to go ahead and make sure at the top right where there's the insured's ID number that you would usually use for private insurance or Medi-Cal number, we would just go ahead and have you use the HACCP ID number right there. So in box 1A. And then everything else should be the same as what you're used to. If you have a treatment authorization request that's been approved, you can include that right where the prior authorization number is. If you have any questions as you're filling it out, definitely give us a call. The telephone service center in particular is quite familiar with these forms and has been answering Medi-Cal questions on them for a long time, so they can help as well. Consistent with what we require in the hearing aid TARs, we did also want to give you a heads up on the clinic side, what guidance is going out to families in the similar webinars for families and community partners. We're asking that families, when they come to their first appointment with a HACCP participating audiologist, that they bring their HACCP ID card, any other health insurance cards if their child does have other health coverage, documents from any earlier appointments like the hearing aid prescription, medical history and examination notes from their otolaryngologist, hearing aid recommendation, audiologic report, if they've seen a previous audiologist as well, so that you've got everything handy, along with anything else that you request them to bring. So we are kind of giving them the same heads up, like, hey, these are all normal things to be asked to bring. Try to request that they kind of keep them together as they're going to these earlier appointments, making it easy. Some of the questions that we get from them as well, just in case you hear these as well from your patients. If they qualify for CCS, don't switch to HACCP. Keep the CCS. It covers so many more wraparound services. However, if they are not eligible for CCS through that service code group 4 for hearing related conditions, then they can still apply to HACCP for the hearing related part, even if they have CCS coverage for something that's not hearing related, right? They do not need to apply to CCS and be denied prior to coming to HACCP. You can enroll straight into HACCP. What'll happen is if we see in our shared enrollment system that the patient already has, or the applicant already has a CCS aid code that indicates they have hearing related coverage already, we just don't duplicate that through HACCP, right? So if they already have that, great. Please don't disenroll from CCS in order to get HACCP, because CCS is going to be able to offer things that we can't. Similarly with Medi-Cal, and this is why Medi-Cal and CCS eligibility exclude you from HACCP, is that they offer at least as much. And while we base our coverage on the hearing aid benefits that are available to Medi-Cal members, the same age range, Medi-Cal still includes that full scope, right? Whereas hearing aid coverage for children program is very hearing aid tailored. As of this year, this is still really exciting and new and shiny. If your child or your patient has partial insurance coverage for hearing aids, they may still qualify for HACCP if the private insurance plan caps coverage at $1,500 a year or less for hearing aids. For the provider side on this, just please know that if your patient has HACCP coverage and they have private insurance, no matter what service you're providing, you're going to need to bill the insurance first, just in order to get the claim through, which even if you're out of network for their insurance, that's okay. If you've got a denial letter or if you've got a claim you submitted and they said, we're reimbursing you $0, that's fine. It checks a box for us on the claim side so that we know we're not double dipping or supporting double dipping with taxpayer dollars, right? So it's just a fiscal accountability piece on the government resources side, making sure that we're good stewards of the tax money that's received through the state as well. So just know you're going to need to provide a copy of that, but essentially that's to prevent the double dipping piece. So if the bill says they paid $0, that's fine. That's fine. Just still send it. But there's no requirement for you to only provide the services that are outside of their coverage if you're out of network, right? You can provide any of the HACCP covered benefits, subject to TAR requirements, right, that are medically necessary for your patients. It's just a billing process, right? It's not an exclusion at all. How do I find, just going on to the next question, how do I find my insurance plan's explanation of coverage? So this is one that a lot of people are getting in the mail right around this time of year for the next plan year. So if you already have that, the mail copy works. You can just take a picture of the relevant pages and then the page that has your child's name or patient's name, or attach, this is for this plan, and here's the child's plan card, showing that they match up to the right plan. If they need any help, finding it or getting a new copy or getting it electronically, a lot of plans also offer this online these days. But you can also call the plan's member services, or if you're having trouble getting through to them, you can call us. We've sometimes got some extra contact information for some of the plans that we can try to help out through the HACCP call center as well, and see if we can assist with tracking something down if you're having trouble with it. For children requiring bone conduction hearing devices, so there are two different types of devices that commonly get referred to as bone conduction. There's the surface worn that you would wear with like the soft headband or like the sticker kind of external attachments, or there's the surgically implanted devices. HACCP doesn't cover anything surgical, right? Because that's it doesn't fit the purpose of the program, right? So those are almost always already covered by private insurance and certainly through the other programs that we talked about today, under their coverage of prosthetics and orthotics. For the surface-worn bone conduction hearing devices, since these are more commonly excluded under the hearing aid carve-out of many plans, or the coverage is limited under those limitations, the surface-worn BCHDs we do cover. And you would follow all of the same TAR processes as for any other new hearing aid. Similarly, assistive listening devices, ALDs, we cover those. You follow the same process. You just make sure you give us all the details of what specific ALD or relevant system is that's being requested. And we follow that same process. Parents should never have to pay out of pocket for HACCP covered services. You as a provider are going to bill HACCP directly the same way that you do for Medi-Cal. The caveat to that is that if your patient has primary health insurance through a private plan and they have a copay, they're going to need to pay you the copay in order to use their private insurance. And the private insurance has to pay their part before we pay our part, because HACCP, like Medi-Cal, is the payer of last resort. So if they're checking in for an appointment and it says $20 copay for their private insurance, you still collect that. And then you bill private insurance as usual. You submit a copy of that, how much they paid or denied to us with your claim for HACCP reimbursement, right? So it's like 1, 2, 3. And we just make that so that there's a carve out of however much you've already been reimbursed from what our allowable rate is, just to make sure there's no double dipping part. But we can supplement up to whatever the allowed amount is if you had limited reimbursement from the original coverage. Is authorization needed to see an HACCP participating audiologist? So certain audiology services do require a TAR. It's up to you as the provider what your policy is going to be around whether you book them in for an appointment, subject to having that TAR approved first. In a lot of cases for appointments, you're going to have more information to support the TAR after the appointment has happened. And generally speaking, I think that's the trend that we tend to see is, we'll get TARs for audiology services after the service has already happened, especially if it's for testing, because then you can kind of take a shortcut for describing a medical necessity by attaching the test results. And there's documentation that, hey, there was medical necessity for these. If that's not the procedure that's available through your office, you can also just kind of spell out for us why there's medical necessity for this particular test at this time. Maybe it's a certain interval that's a best practice, medically speaking, or they are complaining of a new symptom or something to that effect. You just let us know what the medical necessity is. That's always going to be the main part of a TAR, is just confirming medical necessity and that this is the appropriate service. What happens if my child's application for HACCP enrollment is denied? Okay, so if your child or your patient in this case does receive a denial letter for HACCP, that's going to indicate specifically why. So perhaps there was missing documentation that we didn't get. And we close it out, but we can reopen it and help you with a new application whenever you're ready and find that piece of documentation. Or perhaps, income was too high to be eligible. Most often, when we get an application that's not eligible, it's because that child is already eligible for or enrolled in Medi-Cal. And we're able to connect them to that broader source of coverage that can help not just with their hearing aid needs, but with any of their other pediatric needs. So if there's a denial, it'll let them know exactly why and what we're doing to help if we can. For example, we'll connect them with the county office that can help them get signed up for Medi-Cal if they're not already, but they're eligible for it. Similarly, we'll include documentation in that letter that says, here are some other resources too for coverage in the meanwhile, whether that's through Covered California or other programs that can help. Just making sure that all of that's available and accessible. And if for some reason they're not currently eligible for HACCP, we still want to make sure that they get access to the best coverage they can. And again, our call center is available to help if anything about the information requires additional clarification or anything. We're happy to walk through that. And there's no barrier to reapplying the next day if something changes, right? If the household income shifts, or they no longer are living out of state, right? They've moved back to California, yay. They can just reapply right away with the updated information. We'll get that through. We've got a lot of information here about call center resources. So I want to make sure you've got, our webpage as well at the bottom has a lot of the information for these frequently asked questions, as well as just generally walking through the program from the family's perspective. A lot of resources there for community partners, folks working in schools or clinics. We've got all sorts of flyers, social media graphics, if you want to, emphasize that you're accepting our coverage or anything to that effect. Those are all on our webpage at dhcs.ca.gov/HACCP. We do have our call center is available by telephone. Translators, video relay, TTY, TTD are all available. This is during standard business hours, just listed on our webpage as well. So we're all day Monday through Friday, and then Saturday mornings. You can also chat with us during those hours in English and Spanish online. So we have a secure web chat feature available at the bottom right corner of the HACCP webpage. You can also email us, or for questions that are specific to, checking status on like a TAR or a claim, or a specific question about how to use a form, you are welcome to also call the Medi-Cal Telephone Service Center that has the greatest familiarity with those kinds of processes. However, you can certainly always reach out to the HACCP call center, and we'll help connect you with answers to any of those questions if needed as well. So we'll make sure that you get what you need, but definitely let us know if you've got any questions. We would love to help, especially if there's any confusion on anything. And we'll go through the Q&A to that effect as well. So if you do have any questions, could you please make sure they're in the Q&A? We'll make sure that we go through those. And we'll go ahead and hopefully have some additional ones that we can include on the webpage for additional resources moving forward too, and make it easier for other folks to find the information they're looking for as well. I'm going to pull down the slideshow at this point so I can actually chat with you about these Q&A. Okay, thank you very much. So, oops, disappeared. Okay, so the first question we've got is, what does 266% of FPL mean? So it's a very good question. We use a lot of acronyms, I will admit here. So FPL is federal poverty level. Like I said, it gets updated each year. What federal poverty level applies to a particular individual is going to vary depending on the number of people in their household. So we used the example earlier of, 4 qualifying household members. So for that family, it was between $79,800 and just right at $180,000 is that full income range. So the 266% is that $79,800 because of their household size, the year we're in, and the fact that they're in California. There's a chart. We're also making sure that this is available on the webpage, so it's easier to reference. And coming up in January, when the federal government releases the new numbers for 2024, ordinarily, the trend is that those numbers increase further. So this is another one of those situations where if somebody happens to apply in December and they're above 600% FPL for 2023, there's a chance that if they reapply in January 2024, once the new 2024 numbers come out, they may be within that eligible income range once it's adjusted for the new year. Just inflation and other factors, they adjust that number. So that's this one piece. And then for the other part I want to point out around the 266% number is that if you live in certain counties known as HACCP counties that are more expensive, and this is all in the presentation too, when the slide deck is posted, the number is actually higher than 266. I believe it jumps up to 322%, if I'm quoting that correctly. And so there's a more generous Medi-Cal eligibility range for children within that age range that we find some folks will apply to HACCP not realizing they actually had a more generous Medi-Cal eligibility threshold. And so we're able to say, actually, yes, hearing aid coverage, but actually through Medi-Cal, so you get all of this other coverage as well. Next question I see is for whether you need to apply as an individual or as a clinic. Okay, so I'm going to answer this from a patient enrollment or member enrollment standpoint, as well as from a provider enrollment standpoint. So for the patient and their family, they will enroll in the program from the family perspective, right? So the patient, or if they're really young, their parent, or their legally authorized representative, their guardian, whoever it might be, is going to help them apply as an individual or as a family or household. If, for example, if there are multiple siblings, they can apply together on the same application for coverage if they're all needing hearing aids or hearing aid services. The clinic does not apply for them. I know that has been the case in some other programs, but in this case, especially if you're logging on through the online application portal, there's a secure login setup where you don't want all of your patients' applications coming back to you. We need to be able to reach their individual families with questions that pop up and things like that, or have them have access to be able to log back in if they need to upload something else as an attachment, or if they need to save and come back to it to submit it once they've found that one piece of paper that seems to be misplaced. So on the member enrollment side, it's going to be as an individual. On the provider enrollment side, there are some questions around type of clinic that might affect whether you have the ability or the option to enroll as an individual medical practitioner or as a type of facility. So I am not the expert on Medi-Cal provider enrollment, so I don't want to go too far into the weeds on that one. But I do know they have a lot of resources at that PAVE website that we linked. And there's also contact information there for the provider enrollment division if you've got any questions, or you can email us and we'll help you connect and track down a specific question if you want to let us know what type of facility you've got. We can help you check and see what would be eligible for the Medi-Cal enrollment part. From the provider locator piece that's more specific to HACCP, you've got choices. So you can either opt into the provider locator as an individual, if that's how you book your appointments and that's easiest for you to keep things consistent. It really depends primarily on how you were set up when you did your Medi-Cal provider enrollment, because we're going to ask you for your Medi-Cal provider ID. Since you can't be in the HACCP provider locator if you're not Medi-Cal enrolled, because you wouldn't be able to bill us. So can't really participate yet. So as long as you're Medi-Cal enrolled, you're eligible to serve and get reimbursed for HACCP members. But we really, really encourage you to take that extra step of filling out the quick survey to opt into the provider locator. And that can be as an individual or as a clinic, just depending on how you're set up. Next question I see is regarding whether assistive listening devices are covered by HACCP. Yes, they are. And as you mentioned, online it states that ALDs are covered. Yes. However, when reviewing the billing code list, there is no code for ALDs. Can you please clarify? Let me pull this up for you because we have actually been getting this question more often lately. And I want to make sure that everybody has the resources. So if we go into the resources for providers webpage under the main HACCP webpage, which I'll actually put the link right here. We have all sorts of exciting resources here. Everything from upcoming webinars for providers to our links to publications like the HACCP Provider Manual. We also have forms on here, like if you look under schools, there's the HACCP Provider Referral for Patients Enrollment. And again, that can be filled out by a medical provider, whether or not they're enrolled in Medi-Cal, whether or not they participate in HACCP, if they're a medical provider, or if they're a hearing professional. So for example, a school audiometrist doesn't need to be a physician in order to say, I'm a hearing specialist, I'm going to refer this child based on their school audiology screening, hearing testing that's done in schools. That's fine, we'll take that. Because they've got firsthand knowledge of the testing results. So they can just fill out that form and help somebody with their enrollment process. But then we've also got the HACCP Provider Manual linked here under publications. And so if we go down to the second half of the Provider Manual, we've got all of the procedure codes. And you're correct that ALD is not as an acronym in the list. We've got it spelled out as assistive listening device. So that is on page 7 of the Provider Manual, and it is V5267, hearing aid or assistive listening device, supplies, accessories not otherwise specified. So again, like we mentioned, we were going through the TARs, you would still include the relevant hearing aid prescription, medical clearance, otolaryngologist exam, all of this to make sure that a hearing aid is an appropriate fit for the child. But because of kind of the nuances of ALDs and what can fit in there, if it's more of an FM system or anything like that, there is specific guidance there as well. And CCS has some supplemental guidance as well that we lean on that has more ALD specific information around kind of information that can be helpful to include with the TAR. But we want to make sure that we know, and this applies to other codes as well that are kind of a not otherwise specified sort of code. Please let us know in the description what the supplier accessory is. If you're requesting an ALD FM system or something else, or a specific component only, how many of each item you're looking for, any product details, cost page from the manufacturer, that kind of information, so that we have a good idea of, since this isn't an ALD specific code, what is it that we're approving, just to make sure that we're on the same page with you as the provider who's there in the office. So yes, they're covered. The systems do cover the receiver and transmitter. And actually, I believe I think I actually just emailed you about this, Megan. So maybe that got stuck in email land. But we can touch base on that too, because there's quite a lot more detail there than I am comfortable trusting my memory on. It gets pretty technical. So we'll make sure that all of that is also available through the webpage for anybody else who might be looking for it. You can also reach out to us directly. We're happy to help you with one-off situations or where something might be a little bit more complicated than is compatible with the nature of online open messaging. So please do let us know if you've got other questions, and Megan, we can certainly connect on that too, because I think you've got a specific instance that you're talking about. But definitely want to make sure people know, yes, ALDs are covered. It's the V5267, and I think this actually overlaps with another question that we got in chat. Let me pull that up and see if we've got other questions here to supplement. Okay, so one of the questions we got was actually whether rechargers are covered, which is a similar V5267 according to the question. I am not aware of a charger specific coverage policy, Dr. Kamuka, are you? And if we can't find the answer either, we'll look into it and we can get back to you as well, Marcia.
No, there's not a specific policy because there's some aids that are rechargeable and some that are not. Some aids that require the batteries to simply be replaced in other aspects. So, with the goal of reducing the total cost to the beneficiary of having the service, the goal would be to provide an aid that is rechargeable with or without batteries, either now or in the future. So, the additional cost, of the batteries is significant. So rechargeable should have the charger covered. The other issue, that I was alluding to with Marshall Raggio online, which is the whole idea of the risk of having button batteries for hearing aids or otherwise in the world of a small child. We really want to reduce the risk of the child getting exposed to them, eating them, sticking them in their nose, putting them in their ear, whatever they might do. And this is
Yeah,
not really a joke for any
I
of
do
you who've
not.
been in this space for a while. You know that all of those things do happen. So um, yes.
Um, so would that from a TAR and kind of claim perspective, but I think TAR being the first step, would you usually see a separate line item on a TAR specific to the charger, or would that be incorporated into the cost of the primary device for them to have the charger and rechargeable batteries? Because I know our battery codes are for the button type. So would this require a separate procedure code, or would it fit into that same hearing aid claim?
Yeah, it really depends on the provider. In some cases, when the hearing aid dispenser audiologist purchases the equipment from the manufacturer, the recharger is included because the device works best with the charger, and sometimes works only with a charger. So it may be included in that invoice cost. In some situations, if the charger gets lost, if it gets dropped in the toilet, if the kid, chews on it and damages it, another recharger may be necessary or may be unbundled from the cost of the aid. We see both of those. And so in either case, as long as there's clear justification, even a repeat will be covered if the initial one was included or paid for and was somehow damaged or lost or otherwise inoperable.
Okay. And so that would just be under the same V5267 as well, then it's the not otherwise specified, and part of why we need to have all of that description and everything that's included with the TAR line item.
Right, because the invoice that comes from the manufacturer will have it bundled in or unbundled, and it will be clear. And in some cases, when it's not clear to the team that's reviewing, they will ask, just send us the invoice. And just for, kind of expediting the whole process, if there's any questions about that, just include the invoice with the initial TAR so that we can see that you paid for that additional item and, are entitled to reimbursement.
Right. Thank you very much. I do also see a request to the link to the access for the PowerPoint. So the slide deck is going to be posted alongside the recording in our events archive. And so I'm sharing that, and that also has the live captions link. We usually get these up within about a week following the event. So we'll try to get that up this week if we can. Otherwise, it might be up next week. How it's coverage for hearing evaluations managed for private insurance plan members who are seen at another center for HACCP services. So if a patient has private insurance and has been referred to an HACCP participating provider, will HACCP cover their hearing evaluations at the HACCP participating provider? So yes. If there is hearing evaluation or anything else, and it's kind of what we touched on briefly earlier as well, that is covered by their primary insurance, but there's not always an in-network provider for their primary insurance who is also HACCP participating. This is just one of the realities that we live with, and we try to get as much participation as we can, but ultimately there's some free choice there. So if the patient decides they're going to come to you as an HACCP participating provider, even though you're out of network for their primary insurance, okay, is it a covered benefit? Have you already complied with any of the TAR requirements, or are you going to do that before you submit the claim? And they're an active HACCP member, go ahead and provide what's medically necessary for them within the scope of coverage. Please help them get timely care. We will reimburse you. Like I mentioned earlier, we require that page that there's been an attempt to bill their primary insurance. We understand that if you're out of network, it might be zero. It's not a shock to us. We deal with that all the time with Medi-Cal. This is one of the benefits of, HACCP is a new program, relatively speaking, but these are not new systems. So there's a lot of familiarity within Medi-Cal. Okay, sometimes people have, employer sponsored coverage or something else as well, right? And Medi-Cal is the payer of last resort. It's the same thing with HACCP. Go ahead and bill the insurance. If they reimburse part, if they reimburse none, whatever, just send us what they let you know they were going to reimburse, even if it's zero, even if it's $5. Just it's a check in the box for us so that we can get you the full balance of the allowable amount for the service you provided. That's all. So if it's somebody looking for continuity of care and you're providing their hearing aids and programming and all of that, go ahead and provide the other covered audiology services too. That's fine. We'll just need you to show that they did or didn't pay when you billed them first. And if you've got additional questions about that, or if you want to chat through a specific instance, I'm happy to do that as well. You can certainly reach out to us. See, we talked about chargers already. Let's see. Oh, some of these are already answered. To everyone else, you may already have some of these informations, but we talked about making sure that folks have access to testing and when, even if they may have already gotten testing through that primary insurance plan, it may be clinically appropriate to repeat the testing and make sure it's up to date and complete. We talked about ALD coverage already. Let's see what else. If you do have any other questions, please go ahead and add them to the Q&A. We'd be happy to talk through those with you, or we can take questions on the side. Got some additional battery information. Perfect. If you've got make sure I'm not missing anything. Might be an additional question. Okay, so I think the other thing I'm noting is that yes, demand for pediatric audiology is extremely high. What you do is very, very important, and we're so grateful to have you working with us to serve these children, but also for what you do in general every day. If there's anything else that we can do to support you, answering questions or making additional resources available, any of it, please let us know. And similarly, if you're not already participating in the provider locator, please sign up for that as well. We want to make sure that we can make it as easy as possible for families to reach you and reach the right specialist for what their child needs. We really appreciate you joining us today. I don't see any other additional questions, so I'm going to go ahead and close the meeting at this time. But thank you very much, and we really appreciate your time. Have a great afternoon.